Welcome, members of Medical Alley. I'm Stefan Hovard. I'm the president of the Global Urology business at Coloplast Corporation. And it is my honor to serve as your board chair for Medical Alley for the next 2 years. Coloplast originally chose Medical Alley as the location for our US headquarters because of this community. We believe that this community holds all of the skills, the competences, the colleagues and competitors that will keep us strong and will help us succeed with our business. We set up shop here 10 years ago, and we continuously talk to each other about what a fantastic decision that was, and that's again back to this community. As a Medical Alley board member, we've been working to continue to evolve the association to be at the forefront of everything it takes to make sure that Medical Alley remains the global epicenter for healthcare also in the future. I'm excited about Medical Alley's future and the role that the association will play in solidifying that position for many, many years to come. Tonight we're going to hear more about the greatness of the community and the excitement that we all share. And for now, I'd like to welcome you all to the Medical Alley Association Annual Meeting 2017. And when I ask you to just do me one small favor, you'll have about 10 minutes to get know each other at the tables. But before I leave the stage, we have a fantastic team on Olsen Memorial Highway in Golden Valley. Shay and his troops at Medical Alley's organization work with such a dedication and a commitment that I'm always impressed of what they get done. And they do it for the benefit of all of us. So if I could ask all of the employees of Medical Alley organization to stand up. And thank you. I appreciate that, and whatever opportunity you have to thank them for their commitment and their work, please do so on behalf of all of us. Thank you very much. The program will begin shortly.
Thank you all so much for being here. I'm Rachel Ellingson. I am actually a newly minted employee of Abbott, having joined from the acquisition of St. Jude Medical, and I am extremely pleased to be here representing them as our new member of the Medical Alley Association. I am also very honored to have served both as a vice chair and as an executive committee member of the board of directors for Medical Alley Association for the last 3 years. So, as Stefan mentioned, we've been working hard to evolve the association to make sure that we are best able to meet the needs of this incredible community, and it really is an incredible community. We continue to refine our support, make sure we're setting priorities, and make sure that we are ready to address the very real challenges that our industries and our organizations are facing. Our vision's clear, and it's a great vision, right? It's a vision that talks about elevating Minnesota's Medical Alley as the global epicenter of health innovation and care. Great, right? How do you not get excited about that? So, and I think really with a record number of new members, and a lot of you are here tonight, leadership that I saw represented outside and got to talk to a lot of people really across virtually every sector of health technology care, and a focus, that prioritization, that focus on what really matters, I absolutely believe we are well on our way to getting there. One of the things I think is most special about Medical Alley is the leadership and the expertise we have across so many important segments of healthcare, and I think we're in a great position to really help influence and lead the transformation of health innovation and care in this community. But I do want to make the point that I don't think we can take that leadership position for granted. I think that while we're here tonight and we're going to celebrate some successes, and I am incredibly excited to celebrate those because we've got some fun stuff to talk about, I do want to challenge everyone in this room to really think about the issues, too, that are facing our organizations and our industry, and how we can work together to solve them. As a community, with the support of everyone here, I think we have the power to really come together and influence our future and claim that leadership position, and ultimately, and most importantly, to improve lives. So with that, I'm looking forward to hearing our annual State of Medical Alley. It's always a great opportunity to learn more about what's happening in the community on a broader scale. And so I'd like to welcome and invite our Medical Alley Association's President and CEO, Shay Mandel, to the stage.
Wow. Well, good evening, everybody. Nice to see the clap starting early. I see that extended period of networking and having the bar open had a positive effect on the community this evening. I'd like to welcome all of you to the Medical Alley annual meeting and remind you that tonight is for you, the members of the Medical Alley Association. And tonight we come together as a community to reconnect, to celebrate our successes, and to evaluate our challenges, as Rachel mentioned. Tonight is about the power of what we can accomplish together. So we were here 1 year exactly ago, April 27th, talking about our future, and since then, a lot has changed. I don't have to remind everyone that we all got to endure one of the most divisive elections in history, and that the outcome of that election still leaves us with a lot of uncertainty and lack of clarity. And I would submit that it is precisely this environment that today calls this community to a position of leadership to really make a difference. It is this time that requires your expertise, your talent, to deliver solutions and answers for a better healthcare system that, again, as Rachel said, is about improving lives. And despite the challenges that our industries and even the nation as a whole may be experiencing right now, I can assure you that today the state of Medical Alley is strong, and that now is our time. So, before we take tonight's journey through the alley, I'd like to recognize a few people who really made all of this possible. First, I would like to humbly thank, a big personal thanks, both to the Medical Alley Board of Directors and the amazing team that I get to work with every day. It is because of all of you that as an association we are able to do what we do, and I'd like to ask our board members and our team once again to please stand, take a bow, and be recognized. Next, I'd like to thank our foundational and sustaining members. 3 years ago, when I took over, a collection of organizations in this community made a commitment, an extraordinary commitment of time and resources to invest in this community's future. And it is because of these resources and this commitment that the Medical Alley Association is able to deliver the support to everyone in this room that you really deserve. So I'd like to ask the tables of our foundational and sustaining members to please stand and be recognized. You know what I love is that keeps becoming a bigger and bigger group. So if you're interested, let's talk about that tomorrow or Monday. And finally, I would also like to thank those members who made a commitment to sponsoring this evening's annual meeting. This event was always intended to be a gala celebration, and from the experience you have, you know it takes a lot of work and resources to put this on. And so we could not accomplish an experience like tonight without those companies that sponsored. And so I'd like to ask all of our sponsors to please stand and be recognized. And to all of you, our members, I want to thank you for the work that you do every day, for your commitment to this community and to the association. And I want to tell you that for me, it is truly an honor to have this job. When I came to Minnesota a few years ago, I did not think that I would have the opportunity to get to spend my time working on your behalf. And I'm proud to be the leader of this association. And I'm particularly proud to call Medical Alley my home. And I want to thank you for this great honor. So, thanks. Thank you. So who are we, this Medical Alley community that we talk about? Well, together, your organizations deliver a $23 billion annual impact to the state of Minnesota. Over the past 5 years, our biotechnology and pharma community has grown by more than 1,000 jobs and added more than 1 million square feet of space. Our digital health companies have secured investments over the past 5 years that have increased by more than 540%, with nearly $1.4 billion in exits. If you didn't know it, you are the #1 health technology innovation cluster in the world. We are the #1 state in healthcare performance and home to the US's #1 hospital, the Mayo Clinic. And of course, as you all know, you are part of an enshrinement in the Smithsonian as one of America's great places of invention. As you see these numbers, I want to point out, our ability to bring you data, information, rankings, and intelligence has been a key addition to what we at the association have wanted to deliver in our service offerings. And at this time, I just want to put a special thanks out to Alan Rader and Evaluate, who works as our market insights partner to add depth to our research, provide us with access to a ton of great information, and that partnership with Evaluate has really been critical for us to be able to deliver to you the intelligence and information that we've been putting together the last couple of years. So thank you, Evaluate. So that's who we are. What did we accomplish this year as a community? Well, 2016 saw a record number of Midwest healthcare companies attracting new equity investments across the Midwest. And I'm happy to report that Minnesota ranked #1, attracting more than $424 million in early stage investment this year. I'll just run through these. I mean, it's all really good stuff. We'll clap kind of like, at these big power moments so that we're not here for... We also anchored, as you all know, the biggest MedTech acquisition of the year, welcoming Abbott to our community to further invest in the excellence of St. Jude Medical. We saw new headquarters. We saw new headquarters and projects, including Smith's Medical Headquarters and the Destination Medical Center's Discovery Square, which I'm excited that you'll all get to see some new information on later this evening. We saw acceleration in early stage company support, including growth at Treehouse Health, the launch of Incubology, a Minneapolis generator presence, and a record number of new companies created by the University of Minnesota. We saw Bright Health raise $80 million, one of the largest digital health deals in the nation. We saw Sansoro Health down at Treehouse named as the Venture Forum Pitch Competition winner at HIMSS this year. We were named as the 4th most active U.S. metro area for digital health innovation. Fast Company named Minnesota as one of the top 10 states with the best economic prospects for 2017. Wallet Hub named Minnesota as the #1 best healthcare state. 3M was named as the #1 most attractive employer for millennials in the US. And Mayo came in at number 13. So we've got talent attraction on the horizon. We saw MedNet Solutions selected as the most outstanding e-clinical solution in 2016 by the Medical Livewire Healthcare and Life Sciences Awards. And finally, and I know it's been a while, but I do want to recap, and I know most of you had some role in Medical Alley hosting the AdvaMed conference this past fall. And the reason that I particularly want to mention this is AdvaMed's conference has always been a premier conference for medical technology, but this community came together even beyond MedTech, and together we were able to deliver in the 10-year history of AdvaMed's conference an all-time record for attendance and a participation that was unparalleled. And I want to thank all of you for sharing with us that great opportunity to show the world what this community was made of, and I think it was a tremendous success. I'm also proud to once again serve as the chair for AdvaMed of the State Medical Technology Alliance. So I think we can all agree this has been a tremendous year for the Medical Alley community, advancing our global reputation as the epicenter of health, innovation, and care. And as we look forward to the state of our healthcare industry and celebrate the year that was, let's again take a look forward and see where our industries are going and what the role of our community will be over the next few years. So while Medical Alley continues to see growth and investment, diversification of healthcare industries, we do all recognize that today there is a lot of uncertainty. And as I talk to all of you and members that we have here in Minnesota, in other parts of the country, even around the world, I hear regularly from you about the challenges that you face, the uncertainty that we face together, and that even with our successes, I hear words and descriptions, questions, hesitation about the state of our industries and our future. Confusion, disruption, evolution, excitement, fear. I hear questions like, what's next? How quickly can we pivot? Do we have the right strategy for success? We're adapting to new technologies, more data, new industry players, new definitions, and uncertain regulations and payment models, all of which are conspiring to force change. Healthcare buzzwords are driving the conversation. Buzzwords like, and we all know what these mean, right? Speak up if you do. Patient engagement, population health management, telehealth, value, accountable care, disruptive innovation, remote patient monitoring, interoperability, big data, and the list could go on and on. So I hear members asking each other and even us sometimes, so what exactly do these words mean? And more importantly, what do they mean for our organization? And most importantly, what do they mean to our customers or to our competitors? Are we putting patients at the center of care? How are we going to distinguish between actionable clinical information and consumer data in this new world? Is data security the biggest inhibitor to the adoption of new technologies? Are we ready to share risk? What is value? Is it lower costs? Is it better outcomes? Can somebody just give me a formula that I can follow to move our company forward? And while I would love to be able to give all of you these answers, truly, right? I wouldn't be doing this. We don't have them yet. But tonight I'm here to ask all of you to perhaps ask the question, if these answers are to be found, can we find these answers together here in Medical Alley. And while many organizations promote their collaboration, I believe that, we're still a few steps away from different industry sectors being able to really collaborate in the marketplace in a way that makes the kind of impactful solutions that will be sustainable. So tonight, I ask you to join us in getting started. I think that the first step in realizing the value of collaboration can start right here. We have everything that we need in this community, and in fact, right here in this room, to redefine the healthcare environment that we all work in. The Medical Alley Association, thank you. Sincerely, the Medical Alley Association is truly our best bet, not just for this community, for this state, for our nation, but perhaps the world. This is our best bet to bring a group of people together to start a collaboration that breaks down the silos, helps to clarify definitions, and can actually deliver the strategies that will empower this community to create the new solutions and provide the influence that will drive healthcare forward. So today, the Medical Alley Association looks to evolve with you. We will continue to deliver on our mission and our vision, both created by you. And I appreciate that Rachel made a special point of talking about that, those board members who were really engaged. We went through a long process to just get it right, and I feel like we did. Today, Medical Alley membership includes health technology and care leaders from every sector. Again, we have everything we need right here. Healthcare delivery and providers, health plans and insurers, a diverse group today of more than 50 digital health companies and more than 100 in the Twin Cities alone. And of course, biopharmaceutical, medical device, diagnostics companies of every shape and size. There isn't another community in the world with this collection of expertise and leadership, or another association in the world with this diverse group of healthcare leaders. Your membership represents a unique opportunity, and for the association, a sincere, renewed sense of responsibility. We will continue to deliver new experiences, deeper insights, more promotion of you and the community. And here are just a few examples of this diversity within Medical Alley and what your membership involves. Just examples from this evening. So tonight, we will get to interview new board member Mike Guyette, President and CEO of Blue Cross and Blue Shield of Minnesota. We'll hear from Lisa Clark from Mayo and the Destination Medical Center and what's happening in Rochester and around Discovery Square. Later this year, we'll salute our growing pharma and biotechnology community again with the second annual Great State of Farm Bio Conference. And this year we will bring to Minnesota a true investor event, the Medical Alley Innovation Summit, where 40 companies will pitch to a national pool of investors thanks to a new partnership with the publishers of the MedTech Strategist. And we've launched a new microsite on the strength of our digital health members. And when you get home, I would encourage you, go to digitalhealth.mn. This new site will continue to grow. We will continue to populate it. And today we list these companies under the 4 primary digital health categories that we as an association use to set them apart. But we know that digital health permeates everything that all of you do, and that soon digital health may best be characterized for all of us as being truly ubiquitous. So please give us your feedback. Check out the site, look at the categories. Please tell us how we can make sure we're including your organization, we're representing the community, and how we can utilize this site to better advance a growing part of our community, but also, I think, another place where Medical Alley has the opportunity to truly be revolutionary and lead the world. So this tight-knit community that earned a place in the Smithsonian as one of our great places of invention has grown. There are 650 of you here tonight. I promise we'll look at a bigger venue next year to accommodate the many people who couldn't be here. But I think if you've been at this event just the last 3 years, you see the size and diversity of this community really continue to grow. And with that growth, it is incumbent upon the Medical Alley Association to make sure that we are connecting this community's leadership from every sector and engaging every talented individual who really wants to make a difference. So 5 years from now, when we live in a different world, I want us to be able to look back, hopefully on this night, and see that the different world we live in 5 years from now is one that this community helped to lead, define, and influence. We will be working every day as your association to be that core that sets the tables, that brings leaders and innovators together, that drives your thought leadership, that will define what that different world looks like, and that the evolution of healthcare, Medical Alley will be the focus of. Our board has identified some key priorities for this year, and I want to share with everybody what your association is really going to be focusing on your behalf. One, we must connect the dots. So for all of you that for years have been connected one-to-one, seen the dots amazingly connected by Frank Jaskolki and many other members of our team, we know that while we have this unique ecosystem, now we've got leadership across many sectors, and we've really identified that these sectors are not as connected as they need to be. So this will be a priority for us in 2017, connecting our sectors so that Medical Alley can really play that role in healthcare transformation. Second, we need a clear identity of leadership and culture for Minnesota's Medical Alley and clear messages coming from the association. And I can tell you, we have had, I think, great people working on this problem for a long time. As I look out around the audience and try to figure out how we capture the energy and the experience in this room and promote it, it is both a daunting challenge but an amazing opportunity. And we will be prioritizing this year, working on a more promotional plan for this community, our positioning as the global epicenter of health innovation and care. Third, I think we can all agree, we need a state that supports our growth and our industries. We, I think, have the best group of lobbyists in the state. I think we've done a tremendous job as an association, but our board has really been energized about the prospect of talking real strategy for the state of Minnesota. We continue to see other states putting programs and incentives and policies in place that are designed to attract and support our industries. And so we will be establishing a board and member working group specifically to develop a true Minnesota industry strategy focused on making our state more competitive. And so I ask you all to join in that work. Fourth, we know that we really need to be fostering a vibrant, early stage, startup, innovation, funding ecosystem. And while I think a lot of people tonight, you saw new companies you didn't know, you see the University of Minnesota breaking records, you see growth in Rochester, you see the numbers. I think we all know that in order to be who we want to be, we still have a lot of work and a lot of opportunity to really become that kind of magnet for capital, talent, and ideas. So again, we will be soon establishing a board and member working group to identify our gaps and to develop a plan to better accelerate this early stage ecosystem. And then finally, I just want to share with everybody, after 3 years of this journey, at our most recent board retreat, I heard from our board a resounding, "The time is now. Let's get these things done." And so, so they control my bonus, my salary, so, who am I to argue with this? But with this mandate, I want to be clear with everybody here that we will be implementing these key multi-year priorities that are critical both for our present and our future, and that I will be aligning and adding the resources within our association specifically to achieve this work. Today, we've added a senior leader with broad international experience in Kathleen Motzenbecker that I think most of you know. We've added staff and resources to our public policy team. We've expanded the scope of our research and intelligence team to engage with membership, not only to deliver data and information on our community and industries, but to be partnering with you and our working groups to feed those strategies and help define those solutions. We will also be expanding our public relations and social and digital media team, and we'll be working again with our board and a great partner in Stone Arch Creative to improve our messaging and expand our ability to promote your work. And finally, we'll be, again, testing and implementing new technologies that will allow us to better interact with you, deliver content the way you would like to receive it when you want it. And I'm happy to mention tonight, although most of you, since you were coming, probably didn't see this, that we are actually live streaming this event tonight for your colleagues who couldn't be there. So for all of you on Facebook watching, I welcome you at this point. I am really proud of what we've accomplished over the last 3 years. The Medical Alley Association continues to be on an upward trend. We have added members from every healthcare sector and continue to add leaders to our board that can provide new perspectives. And just this year, our new board members include Mike Guyette from Blue Cross Blue Shield of Minnesota, Rusty Field from Upshur Smith, Clay Wildman of Device Farm, and Jerry Bile of FedEx. And I think that represents the awesome diversity of the people and the industries and the support that this community has. We also, by the way, attracted 150 new members, a record for Medical Alley. And I'm not going to wait for the list to finish because it'll just keep running. I think we'll just keep running. Our pledge to you is that we will collect more data, but we will define metrics, we will measure against these priorities and progress, and we will be regularly providing you with updates on our community, our industries, and the value of your membership. We know that even though all of you are committed to this community, you have many asks, and you have limited places to put your dollars, and we want to make sure that your membership in this association is the one check every year that you're excited to write. And as always, I want to continue to invite our membership to please let us know how we can do a better job. Let one of our staff know what you need that you're not getting, a challenge you're facing that we're unaware of, or how you'd like to better receive your information. As I've said to our staff, and the first time I did, everyone looked at me like I was crazy, our goal is actually, my goal is to put the association out of business. When we do that, it will be because we've made every connection, we've solved every problem, we've met every challenge, and Minnesota's Medical Alley is the undisputed global epicenter of health, innovation, and care. So won't you please help me put the association out of business? So at this time, I want to take a pause, and I want to recognize a few people, make a few shout-outs. People who made this possible. There are a lot of other people in this community here tonight doing amazing things, and I just want to mention a few, recognize a few people. First, I'd like to talk a little bit, while she's not here, Dr. Erica Engel founded a revolutionary education program called Science from Scientists. It's produced amazing results in Massachusetts and California. It gets young people engaged in STEM, and it gets professionals like you engaged with teachers in the classroom. And I think this is such an amazing program. And Minnesota is blessed, and Carlene French, raise your hand, Carlene, is here tonight. Carlene is bringing this program to Minnesota, and I really want to encourage you. We're going to be promoting it. I think it's a tremendous opportunity for everyone in the room, but it is an opportunity for Minnesota to be one of those top states that draws the kind of programs like this that today are in Massachusetts and California. Once again, I'd like to specifically welcome Abbott to Minnesota and ask everybody here to please join me in doing the same. I'd like to recognize some past Medical Alley leadership that is with us tonight. We have two of our past board chairs, Steve Mertens and Steve Snyder. Please stand up. Steve was the board chair when I joined Medical Alley. Steve Snyder was the board chair through the transition. Rob Keeval gets no credit as a past board chair because he's still on the board. But he's right over there, so you should grab him later. I'd like to specifically recognize Mike Langley and the greater MSP team, along with our teammates at DEED and all of our economic development partners that have really made a difference in this region over the past handful of years. Doug Kors is here. Doug, where are you? Doug was our champion of the Alley last year. And if you're not aware of Doug's great philanthropy, I would encourage you again, check out his Foundation for Essential Needs, which we also helped to promote last year. I'd like to do a special shout out to Brian Johnson, publisher of Device Talks. Brian, where are you? There's Brian. Late June, Device Talks in Minnesota, year number 5. We're excited. This will be the best that we've had yet. And as a last shout out, I think this one needs a little introduction. So in 1984, the Medical Alley Association was born. And in 1984, the United States hosted its last World's Fair. So my final shout out tonight is reserved for Secretary Mark Ritchie. Mark, where are you? There he is. All right. I know you all know Mark, both as your former Secretary of State, but Mark has almost single-handedly put us in a position to bring the 2023 World's Fair to Medical Alley with a focus on healthcare and wellness. And I think we all a couple of years ago thought, this sounds awesome, how can he possibly do this? And I can assure you at this point, Mark has he's convinced Washington, 2 administrations. He's convinced an international community. If he hasn't already convinced all of you, you should be convinced because this is going to happen. We will be hosting, we'll find out for sure later this year, but I'm betting on Mark, and you should too. But I do want to make a special point. I don't think there's anybody traveling the world today who is a greater promoter of this community and what you all do than our former Secretary, Mark Ritchie. So please give Mark a huge round of applause. So as we look forward to our future, we can't look quite too far just yet. We do have some key priorities and some pressing issues immediately before us to deal with. As you all know, we still face the possibility of the return of the medical device tax, and we will continue to be working closely with our partners and with our congressional delegation to once and for all end this tax. But it's still out there, as you know. We're also facing, if you aren't aware, currently the elimination of the angel investment tax credit here in Minnesota. That tool has produced $400 million of investment in early stage companies in this state since 2010. There are many members in the audience today whose companies either would not exist or would not be where they are without the angel investment tax credit. So when you get up tomorrow, call your legislators, call the governor's office, and let them know that this community demands a competitive tool that brings dollars to our state and that helps us to grow the next generation of companies that will sit in this room 10 and 20 years from now. If you do one thing as an action item after this meeting, please do that. So we know we need a stronger and a better connected early stage system. We need more Medical Alley-based capital, as well as increased interest from investors on the coast and around the world. And we know that we have some significant challenges. We know that one of those is attracting the talent to meet our growing workforce needs, and this will be part of what we're working on this year. I assure you that all of these challenges can be met. The outline of the Medical Alley Association priorities and plans for the next few years provides support and specific activities to address all of these issues that we face. Together, we will not only solve these challenges, but be able to position this community for future greatness. So as I close, let me just say, first and foremost, that you had a tremendous year. We collectively continue to grow, diversify, and power the evolution of healthcare. There is much to be proud of and even much more for us to be excited about. As your association, we are honored by your commitment and your support. Every day, we've got your back. Like you, we will continue to evolve and support your work here in Medical Alley, across the United States, and around the world. We do not aspire to be a great trade association. We actually aspire to redefine the role of an association as we work with you to redefine healthcare and innovation. Again, I think our time to lead is now, and I look forward to doing it together. Thank you for your membership. Thank you for your support. That's the state of Medical Alley. Thank you. So I would like to, at this time, this is not a big enough podium for old school papers. I'd like to invite our Spirit of the Alley Award winners to the stage, as well as Stefan Hovard. So as you all know, each year when we gather together for our annual meeting, we make it a point to recognize a select group of individuals with the Spirit of the Alley Award. The spirit of Medical Alley is exemplified by individuals that provide an extraordinary commitment of time, talents, or treasure that furthers the excellence and honors the history of Minnesota's Medical Alley. The Medical Alley Association recognizes these selfless acts and great investments that sustain and advance our unique and celebrated ecosystem. These are the individuals who always say, "Yes, I will," "Of course we can," or whatever the community needs. We honor these committed servants who always answer the call and give just a little bit more to move all of us forward. Tonight, we salute 5 Spirit of the Alley honorees. I'll introduce each one of them. We'll grab the awards and take a group picture. First, Dr. Susan Alpert. With Susan, we should probably focus on the list of people she hasn't helped as opposed to those that she has, because we would have a much shorter list. Susan has been the top regulatory leader at Medtronic, directed the Office of Device Evaluation for the FDA, advised numerous companies and investors, negotiated for industry on user fees, and was the first executive in residence at the Carlson School's Medical Industry Leadership Institute. But tonight we honor Susan because, in spite of her global profile and responsibilities, she's always been there for us. Susan is a friend to everyone in this community. When I want to know a real answer, because I get a lot of BS answers from people, Susan's the person that I call, right? And she always answers. Dr. Eddie Meradian. Eddie has successfully spent the last 20 years leading MD Biosciences and its group that includes operations in Switzerland, Israel, the United States. And if you don't know Eddie, he has been a tireless champion for entrepreneurs in this community and for the rise of a strong and successful biotechnology community, and that we're known for that in Medical Alley. And this year, Eddie led the development of a partnership between Blossom Medical and Slumberland to create Incubology, a world-class incubator for biotech, pharma, device, nano, chem, including dedicated state-of-the-art wet and dry labs, clean rooms, individual offices, IT development, and collaborative sharing spaces. And I can assure you that without Eddie's vision, none of this would have been possible. Mike McBride. Mike leads partner relations for Upshur Smith Laboratories. And if you really want to know how the pharmaceutical industry works, you call Mike. He always answers, and he will answer any of your call. Now, one of the reasons that I wanted to make sure we were honoring Mike is that for years, Mike has been a tremendous advocate for the pharma community here in Medical Alley. And he has done everything possible to help to grow this industry in our state. From the great state of Farm Bio and our Alley Chats events that are focused, all come from Mike. But I can tell you that for a lot of years, today Rusty Field's on our board and our relationship with Upshur is fantastic. But for years, Mike was the link for our association, both to Upshur and largely to the pharma community. And so Mike, as we celebrate the growth, the connections, I want to thank you for keeping us focused on our pharma industry here in the state. Lonnie Stormo. So Lonnie represents, I would say, today's Medical Alley renaissance man, right? So 30 years at Medtronic, and of course, always on the leading edge, software, diagnostics, implantable devices, quality, services. But today, Lonnie leads Upstart Pops Diabetes Care, which is transforming how people in digital health with diabetes achieve their goals at home. The POPS system is an integrated blood glucose meter affixed to the back of a smartphone and a Bluetooth-connected companion app that focuses on behavior change. Now, part of Lonnie's funding path for POPS included the Angel Investment Tax Credit. And as we look at a future that perhaps does not have that tax credit, I want everybody to take a look at a future that doesn't allow a renaissance man like Lonnie to create a company like POPS Diabetes Care. Lonnie has appeared every time we've asked, and sometimes even he asked. He has given his time, he has been at the legislature, he has testified on the importance of the Angel Investment Tax Credit, as well as our agenda to expand the R&D tax credit. And so when our legislative agenda is successful this year, Lonnie is someone that we all will need to thank. And then finally, Senator Carla Nelson. Senator Nelson represents one of the most exciting areas within Medical Alley today, Rochester. In addition to serving one term in the House and 3 in the Senate, Senator Nelson is a teacher and a professional services family business owner, but most importantly, she truly understands the importance of our industries and continues to be a champion for improving Minnesota's business and research environment. Senator Nelson's leadership includes support for growth at Mayo, expansion of the R&D tax credit, and bringing Minnesota's definitions, and I know this doesn't sound important to everybody, but it is, around biologics and biosimilars into the mainstream with other states. And so as we embark on our strategy to really have a plan for the state of Minnesota, Senator Nelson will be a leader that we will be counting on to listen, to help to educate her colleagues, and to make a difference in our future. These are our 5 Spirit of the Alley Award winners for 2017. Please join me in giving them a big round of applause.
So good evening, everyone. My name is Lee Jones. I'm the founder, president, and CEO of Rebiotics. It's really an honor for me to be able to serve on the Medical Alley Board of Directors, and I bring a different perspective. I'm not the Medtronic or the Abbotts. I actually run a small entrepreneurial company that we're developing in the biotechnology space using the human microbiome to treat disease. It's this type of diversity from large company to small company, from medical device to drugs to insurance to healthcare providers, diagnostics, and a number of other areas that's represented on the Medical Alley board that brings this diversity of experience that allows our community to make a significant impact in the future of healthcare. Tonight I have the privilege to introduce you to Lisa Clark, Executive Director of Destination Medical Center, Economic Development Agency, and Jeremy Jacobs, Development Executive with Mortenson, to give you an update on one of Minnesota's most exciting efforts, Destination Medical Center and Discovery Square. Please join me in welcoming Lisa and Jeremy.
Good evening, everyone. My name is Lisa Clark, and I'm with Destination Medical Center. Excuse me. I am thrilled to be here. First, it was very exciting to hear Medical Alley's health report. I mean, who doesn't want to hitch their wagon to Medical Alley? Shay, you will be proud to know that all of the people that I met today, all roads led to Medical Alley tonight. The conversations all led your way. And it's so exciting for us in Rochester, Minnesota, to actually be part of the community that he was talking about so much earlier. You're a very large community in the Twin Cities area and beyond. Rochester, Minnesota isn't really that far away, you guys. Come down and visit us. I know you think we're far away, but we are a part of your fabulous community. And I believe a large part of that is due to being part of Medical Alley. So there's a lot going on in Rochester, and I was thinking on our very short drive here this evening, you see, you're going to want to come down there. If we could harness the energy just in this room of 700 of our closest friends and new friends, if we can harness this energy and this innovation and this power, I truly believe we can change the face of Minnesota. I mean, it's right here in this room. So saying that, Mayo Clinic, Rochester, Minnesota, we want to be part of it. We're in the game. We're open for business. So I want to tell you a little bit about DMC, Destination Medical Center, fondly referred to as DMC because it's much too long to say. It's a large economic development initiative in the state of Minnesota, the largest in the state. We have partners, Mayo Clinic, the state of Minnesota, Olmsted County, Rochester, Minnesota, and now all of you. It's such an exciting time for us. I'm the clicker, aren't I? I am. We have goals. Everybody has goals. We are creating this comprehensive strategic plan. It's based on health. It's based on wellness. It's based on biotech, life science, retail, housing. What we're doing is transforming Rochester, and we want to support the growth of Mayo Clinic for the next 20 years. To do that, we went to the state of Minnesota in 2013 and secured $585 million in public support, and that public support will support $5 to $6 billion of private investment in Rochester, Minnesota over 20 years. We believe it's going to create about 35,000 new jobs. 15,000 of those are probably Mayo Clinic related jobs, And the other jobs are all the ancillary services and diverse businesses that we believe we're going to attract in Rochester. It's going to generate about $7 to $8 billion in new tax revenue. So we're kind of a big deal. And it's so exciting because it's happening right now. One of the interesting things we did with this economic development model when we went to the state of Minnesota, we said, we don't want a nickel of the state dollars until you see $200 million of private investment in Rochester, Minnesota. We started in July 1 of 2013, and at the end of 2016, we are now at $297 million of private investment in Rochester, and the state dollars can flow. Those state dollars are going to support the infrastructure that we need in this community to support the private investment that we believe we will garner. So what's happening in Rochester? How is all this investment coming down? This is just a map in our what we call a DMC district, and it shows you some of the private investment that's happening. So we have captured the attention across the nation right now from developers and investors from all over the nation and frankly the world. That's a pretty exciting moment. And we have this great thing we're calling Discovery Square, which you'll hear about in a moment. Discovery Square is where people like us will all come together. Mayo Clinic will be there as well. It's in a sense a campus where people will come together and collide and innovate and create and touch Mayo Clinic and really create this opportunity that we call Discovery Square. You're going to hear a little bit about it. We have a partner that's starting our first life science building. We'll be breaking ground later this year. Mortenson has been our development partner, and we thought you'd want to hear a little bit about Discovery Square because it is in the arena that we're here this evening. So I'm going to introduce Jeremy Jacobs with Mortenson Development to talk a little bit about this gem, this economic driver for the state of Minnesota, for this community. Jeremy?
Thank you, Lisa. Thank you, Medical Alley. Medical Alley has been a great partner for us as we've endeavored to grow the life science community in Rochester. Phase 1 of Discovery Square has been a huge undertaking, and we're super grateful that Medical Alley has been a key stakeholder in that growth. I think of Shay, Kathleen, but particularly Frank. Do you know Frank at Medical Alley? Yeah. He deserves a promotion and a raise and whatever else we can get him. When I walked in tonight, I was greeted by some smiling faces and got my name tag. They gave me 15 drink tickets, and I thought, wow. They either really want me to put on a show or this is a really tough crowd. So, but we're excited to be in front of you. Earlier today, we were in front of the DMC board, myself and Eli Hoisington, who's with HOK, one of our design partners. And we presented to the DMC board just a brief version of what we're going to unveil to you tonight. Phase 1 of Discovery Square has had so many team members at the table, it's almost unfair that I'm here doing this because if the design were left to me, it would be a sad state of affairs. We have RSP and HOK as our design partners. What you see it's truly terrific, and it's the creative minds at that table over there that you should really thank for this. So with that, Discovery Square Phase 1. Here we have the future of bio-life science and research in Rochester. This is going to be a building that will be built for innovators and collaborators like you. We hope it'll become a new home for not only Mayo Clinic, who will have a tenancy in this building, but also many of the companies that have called Minnesota home for a long time. We also are, through our partnerships with Minnesota Deed, Colliers International, who's our brokerage partner, Medical Alley, and others, we have our fingers and tentacles and conversations literally across the world about companies who are interested in being in Discovery Square. What's interesting for us about that is that oftentimes traveling in the Twin Cities where I'm based, people know less about Discovery Square here than they do in Australia, which is a really credit to Mayo Clinic and the strength of that brand and how well it travels. A space inside of the building for innovation and collaboration. Light, bright, welcoming, some place for the public, researchers, educators, collaborators alike. We feel like this is going to put a new face on the corner of 4th Street and 2nd Avenue. It'll line what we call Discovery Walk. It's got a great presence, as you see, with that area that interfaces with the public connection. The public realm is a huge portion of Discovery Square. Engaging community and welcoming everyone in is a big part of what we're trying to do. One of the hallmarks of our design is putting science on display so that when you walk in, it becomes immediately obvious the type of research that's taking place. It's no longer going to be a mystery what's happening. We think that's a sort of fundamental proposition of the building, is that people will be inclined to know what's happening. Not only that, you're going to want to be there. This is an exciting place. The first floor will have a cafe that'll open up to the public, and you'll be there. There's going to be great pedestrian-friendly promenades, cantilevered building that'll provide you with an enveloped feeling as if you're in the building, though that you're on the outside. And again, our partners, from design partners, engineering partners, our brokerage partners, Medical Alley, and many others, a project like this has to be done with a village. It's taking a village, and day by day, we're getting there. Thank you so much.
Hello, good evening, and welcome again. I'm Tim Frischman. I'm a principal with First Group. Currently, I'm the longest standing board member of Medical Alley. I'm in my 9th and in my last year. I also chair the Nominating and Governance Committee, and I sit on the Executive Committee. Over the past 9 years, we've seen many changes, both in our industry, our community, as well as in the association. I'm extremely proud of what everybody has done to be able to make this community as strong of a fabric for the health and medical ecosystem. It is a great place that we find ourselves today. I'm very pleased to be able to announce and introduce Mike Guyette. Mike is the president and CEO for Blue Cross and Blue Shield of Minnesota. He currently serves over all the strategy and operations of the organization. They oversee 2.9 million Minnesotans, providing a variety of healthcare products, insurance solutions, as well as healthcare services, technology, and innovation. Through Mike, when he arrived, he was able to bring a very innovative and connected approach to the consumer. Through that, they were also able to introduce Minnesota's first retail store, and that was in November of 2014. I will let Mike expand on a little bit more of his innovative ideas, but we're extremely pleased to have him on the board. Prior to arriving in Minnesota, Mike was with Aetna, Florida Blue, as well as Prudential Healthcare. In addition to sitting on the board for Medical Alley, he sits on the board for the Minnesota Healthcare Council. He also is the board chair for Prime Therapeutics, BSCS Financial, as well as a number of other boards and associations across the country. With that, I'd like to welcome Mike Guyette to join Shay in a fireside chat.
Not exactly a fireside, but I can assure you this will be cutting-edge journalism at its best.
But is this the hot seat is what I want to know.
No. I
Oh.
mean, no. It's truly, this is an honor. As you can imagine, as healthcare continues to obviously change, while these relationships have always been critical, being able to have Mike join our board, bring the perspective of the largest plan here in the state of Minnesota has been an amazing experience in a really short period of time. And we look forward to being able to continue to work with Mike and other members representing all of these sectors to really move things forward. So with that, let's do some hot seat. We're going to talk about some things that we probably haven't talked about a lot at Medical Alley meetings in the past, having Mike here. So, all right, let's start. Mike has not seen any of these questions, I can assure you. All right, Mike. So over the past couple of years, your plan and all Minnesota health plans have really experienced their worst years in decades.
You're going to start off with that
That's
one?
not the fake news part. So the market's changed. So, I mean, talk to us about how the Affordable Care Act and changes in the marketplace have gotten the plans in Minnesota to this place.
Well, let me first start off by saying I am really proud and glad to be part of Medical Alley and to get connected with a different side of the industry that, many parts of the industry that we normally don't interact with on a regular basis. I was saying when I walked in here, I didn't see a lot of familiar faces, and I'm used to walking in and seeing quite a few familiar faces and didn't see that here. So that's really good for us as we try to make sure that we get connected with this side of the healthcare continuum as well. So appreciate that. Although, Tim, you lied to me. You didn't tell me that part of the new board chair is sitting up here, so that's fine now. I'll work it through.
Again, we told you what you needed to know for us to get.
Sure. As you can tell, I'm trying to skirt the question. So let me tell you, the last 3 years have been challenging. Challenging not just for Minnesota health plans, but across the country. And I sit on the board of the association, Blue Cross and Blue Shield Association, that covers 105 million people nationwide. And I can tell you there are very few blue plans that had any success with the Affordable Care Act over the last few years. The Affordable Care Act, I think, did some really great things. It brought access to people. It brought access to care to people. And it gave some people financial stability as well. What it did not do, though, was address cost. It did not address the medical cost side of the equation, and it did not really truly understand some of the underlying factors of what those costs are. And so, one of the big ones is just how we pay for healthcare. And I think you all are aware that we're mainly in a fee-for-service environment. We pay for volume. And so you can only imagine the more you do, the more you get paid. And in healthcare, we should be paying for outcomes. We should be paying for quality. We should be paying for value. And that was not addressed during the Affordable Care Act. And so as we added, pick your numbers, 12 million, 20 million, whatever, who became insured, you added additional volume into the system where they were now going to get paid for. And when I say that, I mean provider partners. And we didn't really take the time to address how care was delivered. And I know a lot of the companies here are trying to impact that, and I applaud you for being the innovators out there that are trying to help with some of those new solutions. But until we will not solve for this until we change the way we pay for healthcare. I'm absolutely convinced of it, and it is one of our missions as the largest healthcare provider in the state. And I'm talking about who covers Minnesotans. I know there's a big health insurance company down the street, about 10 miles from our headquarters. But as far as covering Minnesotans, that's Blue Cross Blue Shield of Minnesota, and we need to address that. And we're really taking a big initiative and moving forward with that.
So, Mike, I think you mentioned one of part of the reason that we were certainly the association was really interested in being engaged with you, and I think you with everyone in the room, and I appreciate mentioning not seeing a lot of familiar faces, is that and probably many of you in the room aren't aware of everything that Mike's been doing, but you've really been doing some innovative things at Blue Cross Blue Shield. So lots of investments. I mean, I think Tim mentioned opening the retail centers. I know we have other members in the room here. Blue Cross Blue Shield's been an anchor at Treehouse Health, invested in Livio and Retrace Health, Learn to Live. So, how does this fit into the game for Blue Cross Blue Shield? These investments, working with digital health companies. I mean, what's your sort of strategy and how you look at innovation? Why are you making these moves?
Yeah, sure. So I hope what you'll hear tonight is we are not your typical Blue Cross and Blue Shield plan, and we're not your old stodgy health insurance company either. We have a legacy and a legacy over 80 years of covering Minnesotans. We're actually the first Blue Cross plan in the country. So we have a very strong, proud history of that, and insurance is absolutely a part of who we are. But we actually launched a new brand called Stella Health. And it's out there, and it's investing in new startups or mid-stage companies. We have an arm that invests in VC. We have a VC arm, as well as looking for new ways to create and innovate new opportunities to improve healthcare in Minnesota. The reason we're doing this isn't about driving down cost necessarily. It is about changing the way healthcare is delivered going forward. And what we see on our side is, just like you're the connector here in the state of Minnesota with all the various stakeholders, we actually have quite a bit of data, and we actually touch virtually every single Minnesotan in some way, or we have in the past. And so we are looking at using that to leverage a way to simplify healthcare and make it easier for people to navigate, easier for people to understand, and ultimately drive some of the cost out of the system over time, and really drive predictability and drive stability in the system going forward. And that's what's been lacking for years, is that predictability and stability in the system that's out there. And so that's why we're taking this different approach here in Minnesota. We're driving innovation, we're investing in new organizations, and we're trying to find ways to add to that stability and change here in Minnesota.
So you've mentioned, so as you talk about innovation, stability, certainty, I mean, you mentioned, paying for outcomes. A lot of people in the room tonight, as I mentioned earlier, these buzzwords are out there, but, privately, I mean, everyone will talk about, and you mentioned publicly, our fee-for-service world. So when you look at the bigger picture, for companies that are trying to get to that value equation, that gold standard, whatever it means, for Blue Cross Blue Shield, what does that mean, value? How are you looking to measure outcomes in terms of reimbursement? Give us a...
Yeah, so there's a couple points in there I think I heard. One is, what is value? And the second one is kind of how do you measure it, or how are you trying to change maybe the payments? I think that's the question. So first of all, value to us is really consistent quality at an affordable price, essentially. So how do we make sure that people are getting quality health care and making sure that there's a fair price for those services going forward? The variations in payment out there for some of the same services are tremendous. You think about just your basic colonoscopy, you can...
I like to not.
Yeah. Actually...
Does anybody like to...
Where's the Mayo team? I went down to Mayo, had mine. You should go down and get it done.
I'm sure I will when I...
Yeah. I didn't tell them who I was. I was afraid, what the experience was going to be like.
See, this is
So I
what
went in with
happens
an
when you
alias.
bring somebody new to the table.
I'm just saying, I was being careful, but nevertheless, when we look at the variations of payments, you can actually see almost a tenfold difference in price for the same service. And we're sitting here saying, why? If the quality is similar, why would you pay 10 times different for the same service? So for us, we continue to look at what that value is going forward, and we do have the data, we do have the opportunity to make some of those changes. Now, how are we doing it? We're working with our provider partners. We're not out there setting the way it needs to be done. We're actually working with our provider partners who, frankly, I think have a very difficult job. Because trying to move from fee-for-service to more of a value-based payment, they're trying to understand, just like you all are, what's the revenue model that you're dealing with? And so how do we help them understand to make that transition from fee-for-service over to a value-based? So what we do is we work with them. We try to understand what the quality metrics are. And each provider system is probably going to work a little bit, start at a different place. So we can't just use one size fits all. And so we work with them to understand what quality metrics do they want to be measured on, set a baseline, and then we look for improvements. And right now, the way it's working with our providers is we're trying to slowly transition them to more value-based payments instead of volume. So you start off with a little bit, because nobody wants to get hurt through the change, and so we make sure that we have it set right, and then over time, we can see there will be a tipping point where we will move more to value-based from volume-based, but it's going to take a little time. Now, unless the federal government really drives this hard in Medicare, you're not going to see this happen as fast as we all would like. Because right now we're dealing with different payers, different insurance companies, different providers, and you look at different segments of the population and how they're being compensated. So it's challenging, but that's the pathway, is to kind of look for that tipping point and then flip it.
So I mean, you're obviously talking a lot about step one, working with providers to, sort of test the waters. Obviously, there are a lot of people in the room that are either plans, insurers, or providers, but certainly part of that ecosystem is, how far away do you think we are from some consensus? What can drug and device and diagnostic and digital health companies bring to this conversation to accelerate, or are they holding back the ability to work with providers to find consensus around value?
Yeah, so as I look at, and I can't tell you how many emails or phone calls I get on a daily basis almost about new product, new services, that we should try to cover or we should take a look at. Lots of great thinking out there, lots of great innovation out there. But what I would suggest is, as you look at the value that you're bringing forward, make sure that it's sustainable and it's not just short term or a short spark. It needs to be sustainable, and it needs to be has some substance as well. It has to be meaningful. Right now, there's so many dollars flowing through the healthcare system, as you can probably imagine. Payers like ourselves and even providers that I work with and talk to are looking for that meaningful and sustainable change or value that can come forward. So when you think about medical devices or services, even some of the digital apps that are out there that are going to make it simpler and easier to use, just think about how the long-term view of that will play out, because I can assure you, as we look at those, that's what we're looking at. And we're saying, we're not looking for a quick hit or a quick saving short term. You have to look at how it's going to change really the experience for the member at the end of the day. Because I would say when I say they, the individuals, you, consumers of health, are going to be in the driver's seat probably in 5 years. I think that's where we're going to see a huge shift, and where the consumers are going to demand to know what their choices are and what the cost is going to be. And we've all been trying to play with that, and it's been all around the edges, but I do think in 5 years we are going to see a significant change.
So if we go out 5 years, so we did not rehearse this, by the way, but I said earlier, so 5 years from now, when we live in whatever the different world looks like, and you're talking about that role of the consumer. If we look back on this night, from your perspective, if that's where we're going to be, what's the best path for us to be working together to get there?
First of all, you need to put the member, the individual, at the very forefront of what you're doing. It doesn't matter where you sit in the value chain out there. Think about how it will impact that individual. And if you can't find that direct line to that individual or that member, you need to look at a different business model or a different business that you're in. Because they, the consumer, us, utilizers of healthcare, will be driving this going forward. And as we look at that path to simplifying health, giving people decision support that they need, understanding what their choices are for care, it's different for each of us individually based on just our own health, our age, what our aspirations are as individuals. All of our health goals are slightly different. And so think about how you can help impact that. So I would just say, there's not a clear path, Shay, that will just get you, here's the formula, because I certainly am not the person that would give you that secret sauce. What I do know is if you think about how you'll impact the individual, that's a great starting place. And then think about long-term, how that's going to get impact as well.
And as we move forward with innovation, so in healthcare today, I'm sure you would agree, there are different kinds of innovation. So certainly, I think Medical Alley, the community has traditionally been, one of the leading innovators around therapies and therapeutic improvements. Everybody's going through a little bit of, business model innovation, whether it's, actually drawing that direct line to the patient or kind of reconstructing business models to deal with the current environment. And then we've got, all of the data use and behavioral changes, et cetera. So you guys are kind of playing in all of this space. What's most important, or as a community, perhaps, where are we farthest from today? Is our pathway just driving new therapies and technology innovation? Is it really everybody taking a step back and taking a look at a business model that really needs to be adapted to this 5-year shift to get there? Or are we all going to be kind of pushed aside a bit by the massive amounts of data and consumer interactions with technologies? Which of those do you think will be the key driver?
That's heavy, man.
Yeah, it's deep. I know.
Jeez.
Yeah.
That's really heavy.
By the way, I don't even know exactly what that question was. I wouldn't try to answer it. Sounded good, though.
Here's what I'll say.
Translation, pick anything you want to talk about for the next 3 minutes and just lay it out there.
That's pretty much what I got out of that one. So,
Yeah.
Thanks for the platform. I appreciate it. What I did hear was is how important is data, and how is that going to drive decisions going forward, or do we get out of the way and just try to just deal with the cost pressures maybe? I probably added a little bit there, but is it cost that we should be focused on? Is it the digital aspect of what we're doing? And I would say all three of those are important, and we're focusing on all three of those. For us, Blue Cross and Blue Shield of Minnesota, we are data heavy. We have tons of data. We just don't know what the heck to do with it, and we're not analyzing it as well as we should be. And so we are drilling down, and it's not just Minnesota. We have access to data from the association perspective, and so we have this database of not just 105 million people. We probably have the data of 250 million people easy at the association, because you think about the churn, you think about how the Blue Cross brand is, and what we did do, and I led this effort at the association, is now every Blue plan in the country now has all of their data in one place. Now it's de-identified, so they can't see what Shay Bandel's doing, or what Mike Guy's doing. But what we can do is we can drill down to the zip code of what is going on in a particular zip code around health. And so we are now taking this huge amounts of data, and we're able to utilize it to help us really improve health in those communities. And that's the big focus. So that's data is the big deal. And I was kind of joking, but I'm not. We have so much data, and we've collected it, which has been great, but now we need to know what to do with it, and we need to analyze it and make sure we're using it for good and for the right reasons, and making sure that we get out there, and working with you even with some of this data. So this data isn't necessarily secret sauce that we don't want to share. We actually do share our data with quite a few companies trying to help improve healthcare. Don't email me tomorrow looking for all the data. I'm just going to put it out there right now. Yeah, I know. I just saw a couple people going, great. So that's the one. The other one is the digital aspect of health. We are piloting right now all over the state around what digital means and how we can connect back with our members. And so you think about glucose monitoring, and I saw one of the recipients of the award up here. We're working with a company called Gluco right now, and we're looking at remote monitoring for this, and it's a pilot. We're also working with a couple of companies helping us with texting our members, specifically around our Medicaid members. So a company called CareWire that helps us communicate with those Medicaid members to know what maybe some of their next treatments might be to keep them compliant and help improve their health. We work with Doctor on Demand as well, looking at telemedicine and seeing how that gets impacted, or how we can help impact health. And then some of the investments that we made, like Learn to Live, great company that we actually piloted on our own employees. I tell our employees all the time that they're guinea pigs. And so we test with our own folks first, and then we launch out into the community or to our customers. We just want to make sure it works. We don't test everything on our employees. That didn't sound right. The Abbott folks are like, really? What can we test on your people?
Rachel wants to know how you got that past legal, I see.
Yeah. Oh, the guinea pig thing? Or
yeah,
just
the guinea pig thing. Yeah.
A pilot. We pilot with our, thank you. So emergency room diversion is another area that we look at. How do we help improve care for people? Because we all know not everybody needs to go to the ER. And so how do we help improve their life, improve the quality as well?
I just want to let everyone know we will actually, and we'll have a couple mics in the back, we are going to open it up for a couple of questions at least.
Whoa. From the audience?
For Mike.
Dude, this is not part of the deal.
This was exactly
get up
part
here, man.
of the deal. I'll send that email to everyone later. But I'll ask a couple more questions as we're kind of getting ready. So, here in the room, so if you two are to that provider community, which obviously you spend a lot of time talking to, but in this forum, if you could ask one question of the provider community, what would you ask them? What would you want to know from them that you're not getting today?
I meet with our provider partners weekly almost. So whether it's the CEOs of some of the big health systems, or sometimes it's some of their staff, or some of our primary care physician groups, or even specialty groups. And I think my biggest question to them is how do we make change really happen? Because I see it, they are frustrated in how they can actually change the way medicine is actually delivered or practiced. And they are trying their best as well, and I'd like to know how we can help. And it's not just about the money. It is about the money, but it's not just about the money. And so how can we help them, whether it's processes or information, is it data? How can we help them, help our provider partners change the way the care is actually delivered? Because I think at that point, we can get rid of all the waste, and we've heard the numbers, 30%, 25% of waste. I personally saw it on Monday when I went to try to have my knee checked out. And I was given an immediate choice of surgery without even having an MRI, or I had X-rays. Went to take a look at those I had done last week with my primary care, and so it's just amazing sitting there and looking at some of the choices that, if you're uninformed, what happens to some of the uninformed people out there, and it's really scary if you think about it. So again, I'll just repeat it. I ask them all the time, how can we as a carrier, with all this data, this information, how can we help you change some of those practice patterns for the most part? And I never get a good answer back, because I do ask that question a lot. And what I hear is it's really hard. And some folks went to med school and were trained a certain way, or this is the process that we have. Or we can't just do it for Blue Cross, we'd have to do it for everybody else. I'm like, well, that's fine. I'll get everybody else in the room and let's see if we can't do that. And that's actually what we will be trying to do here going forward. And we announced our Future of Healthcare initiative just last week. And part of that is around clinical innovation. And part of this is about convening some of our peers and some of you probably here and looking at a different way to deliver healthcare here in Minnesota. And if we can't do it, one of the most innovative states, one of the states getting the most funding for startups in healthcare that you pointed up, and congratulations to Medical Alley for all the hard work that they do there. But if we can't do it, nobody else in the country is going to be able to do this. And so we need to find a way to drive for that here in the state.
And we are going to do it here. And so one of the questions, I think you have less, certainly, less, at the higher level interaction with drug companies, device companies, diagnostics companies, a lot of the folks in the audience. What's one of the questions that you would want to ask them as we look at model change going forward?
Again, think about the value you're bringing to the equation. So, when I look at the pharmaceutical side, and there was a big, to do about the cost of drug prices, to me, there's obviously a reason why some of those prices are high. And if you think about the research and innovation that happens there, that's important. I get that part. But what does it deliver, and what does it deliver or offset on the other side? So those of you who are involved in medical devices or medical services or other, think about what the offset is on the other side. Because if you're just adding cost, then maybe that might not be good. Maybe it improves quality, so okay, I get that. But there's a price for quality, and there will be a diminishing return for some of that, because the system can't afford it. So think about whatever you're working on, think about what the offset is on the other side. And when you talk to providers, or talk to payers, or talk to regulators, or talk to our legislature, or whoever, think about what that offset is. And make sure that you can actually communicate that and deliver that back to us. It'll just make it so much easier to have that conversation. That instead of, I've got this great new service, a great new product, yeah, it's going to cost a couple $100,000. Yeah, it's going to save lives, but we're going to be sitting here, and others will be looking at, providers as well, how easy is it to implement? What's the safety? What's the offset going to be over the long term? And so just think about maybe that is what I would suggest.
So as we look forward that 5 years, and you mentioned, the patient really being at the center of it. What do you think? Share with us, what does, from the patient perspective, so now we're all on the other side of the equation, what does that experience look like, do you think, in 5 years? And how will Blue Cross Blue Shield help get us there? What the interaction with healthcare?
Yeah. One of the things that we're looking at, in addition just to the clinical side of healthcare, is looking at the social determinants of health as well. And if you think of the other things that affect people's decisions and how they interact with the healthcare system, what I'd like to see is people going into their healthcare provider and understanding, what their choices are. Because there's choices for virtually every diagnosis or every situation that you have. So make sure they have an informed choice, they have information and they can understand. And have that provider, the care provider, helping them with understanding what that choice is. I think they also need to have someone in there helping them understand what their financial impact is going to be as well. So healthcare plans have now high deductibles, there's HSAs out there, as you know, but there's different costs for different services, right? So I had to make a decision, MRI, or do I just say, doc, I'm gonna wait a little bit longer. How about a prescription for PT, physical therapy, and let me go try that for a month, and then if that doesn't work out, maybe then I'll go ahead and get an MRI, and let me make sure I know how much that's gonna cost with you versus, maybe a freestanding place down the road here. So you got the financial aspect of this. And then the other side of this is looking at some of the other social determinants that are impacting people. So you think about people who are sitting here going, okay, use my knee as an example. I may need surgery, but the person that you're talking to may not be able to take time off. Maybe a single mother. So they're gonna sit here and make other decisions about how do I care for my kids? How do I make sure that I can continue to work? Because I may not have some of the paid leave that some of us have at some of the larger organizations or some of the financial support that others may have. So we need to make sure that we understand, have a full 360 view of that individual to help improve their health. That's what I'd like to see in 5 years. Have kind of a three view of the individual. Understand my choices for healthcare for this particular situation I might have. Understand the financial impact to me personally and my family. And then also understand, here's some other things that are going on in my life. And let me tell you why I can't stay compliant on my insulin. I know that's one of the biggest issues that we're dealing with. And we're spending a lot of time as a company right now trying to understand how we can help impact diabetes here in the state. It's one of our strategic initiatives as an organization. We did this with Big Tobacco many years ago. Those of you who may or may not know about the legacy of Blue Cross and Blue Shield of Minnesota, but about 15 years ago, we fought Big Tobacco. We won. We were the only organization that won with the help of the state. The state got some dough, we got some dough, and now we're using it to help the community and help impact. We're trying to do the same thing now with diabetes as an organization. We're really excited about that initiative. So I went a little further.
No, that was
because you gave me this platform. I figured I'd keep talking.
Absolutely. So, how likely 5 years from now do you think it is that we will be able to have those 3 points of view, if not to truly resolve them, because certainly the other issues around their family. But do you think 5 years from now we'll be there?
I think it depends. That's why I'm sitting on your board. It's going to be one of your new goals.
It is. All right.
I know my name's not Stephen. I'm not going to be chair, but but I do think that. No, all kidding aside, I do think there's an opportunity. I really do, and I think organizations like yourself that convene and pull people together. I think working. I was talking to Senator Nelson. Where are you, Senator Nelson? There you are. We were connecting over there. Call out to you. It was great to meet you tonight. But we've got some great opportunities to even work with our regulators in the legislature on some of this. This is a great state. I have had great opportunity to work in a lot of states around the country. I was responsible for national health care with Aetna at one point, and this is a great state. And as I said before, if we can do this, it's here. But we've got to come together, pick 2 or 3 things to focus in on, and then make that change happen here in Minnesota. And that's my focus as leader of Blue Cross Blue Shield of Minnesota, is convening and pulling that together. So I think there's an opportunity, and I'm optimistic.
All right. I think we have time for a couple of questions from the audience. A couple of mics in the back. Somebody raise a hand. Mike, again, was gracious enough to say, yeah, let's ask the audience. So time for a couple of questions. Hard to see from back here, Michelle. So.
Shay, if I can.
Oh.
I had the pleasure of working for Blue Cross and Blue Shield of Minnesota for 25 years, and I was in the division that talked a lot about partnerships, and partnerships always meant working with big clinics and big hospitals. And we always viewed the technology industry as part of the problem and not part of the solution. So is your participation in the board in a leadership position with Medical Alley an indication that maybe Blue Cross of Minnesota can look to this industry potentially as a partner and a part of the solution as opposed to the problem?
Yeah, so what I heard you say was when you worked at Blue Cross, you were part of the problem in the past about keeping technology out of helping healthcare, and I am just joking about that completely. You know, we're at a whole different stage of where healthcare is right now, and everything is getting connected, everything. And for us as a payer, the largest payer in the state, with all this data and not being connected to with what you do every day is totally wrong. And so the answer is it's not just a hint or a clue, it's a commitment by Blue Cross and Blue Shield of Minnesota to find a way to make sure that we're getting committed or connected to the technology side of healthcare. We have to. Think about what's going on with wearables and remote monitoring and how that can impact the quality of healthcare for people. And that's transformed significantly just in the last 2 years. I know it's probably started a long time before that, but just in the last 2 years is we're seeing big impact. And it's only going to evolve even faster in the future here. And so I'm excited about being part of that, which is why we're connected now with Medical Alley.
One more question.
Hi. Yep. Hi. I have a question about telemedicine. And as I look at it, I think it's a huge opportunity to save costs in the healthcare system. And right now there are limitations on asynchronous telecommunication. It has to be real time. I was in my OT today, and they've developed it. Everybody uses it in their practice. They can't get reimbursement for it. And my company is also looking into this. How do you see telemedicine evolving for reimbursement within Blue Cross?
Yeah, so we constantly look at what the codes are, what the services are delivered, and then how people are reimbursed for various services. As the technology moves ahead, sometimes payment methodologies or payment is not necessarily keeping up with that. One of the things that we are doing is we are working with some of these companies, like whether it's Doctor on Demand or some of our other providers that we work with, to try to understand what is it that you're doing for the services, what are you not getting reimbursed for, and do we need to change the way that we're paying? Right now, whether it's through some of the coding that's happening, it's something that we need to kind of pull back. So I do think there is an opportunity there, and I think we were or are working on telemedicine and how those reimbursement rates look like and what you're getting paid for and not what you're getting paid for.
I guess my follow-up question is, can it be asynchronous and not real time?
Explain.
Does it have to be one person directing the therapy, or can they do something offline where you could measure compliance when there's already an 80% non-compliance in physical therapy, but you could measure compliance, and they could do it at night, or a therapist could do it off hours?
Okay. Yeah, so probably not something that I can answer directly for you. I'll be happy up here on stage, but I can certainly get your information, or you can email me and make sure you get connected to the right person to understand all those different pieces of that. Thank you. Sure.
So, want to be sensitive to everyone's time. We are a little bit over. I think you can see, I mean, obviously Mike is a great guy and engaged in our board, and we've had a lot of fun, but I also, I hope everybody sees, the serious leadership, the innovation, And Mike's interest in not just being part of this entire community, but really taking a leadership position, being here, wanting to engage with this community. And as Mike said, I believe if this can happen, if we can break down sectors and silos and actually make progress and get to that place in 5 years, there is only one place where it's possible, and it's here. And it's here in part because we have leaders like Mike who are willing to step forward, change the game a little bit, and be engaged in a different way. So I would like to thank Mike for his leadership, being on the board, being here tonight, and I'd like to ask everybody to please give Mike Guyette a huge round of applause. Thank you. And so with that, the 2017 Medical Alley Annual Meeting comes to a close. I would be remiss if I didn't tell you all to please fight for the beautiful centerpieces. They are yours to take home, whoever can grab them first. And again, I really want to thank everyone. Thank you for your membership. Thank you for your leadership. Thank you for being here tonight. And here's to another wonderful year in Medical Alley. Have a safe trip home, and thank you.